Hello and good day to all. First of all, I would like to thank the officers and fellows of the Philippine Academy of Family Physicians for allowing me to share this advocacy in your on-demand modules. I'm Dr. Irwin Tabu. I'm an orthopedic surgeon from University of the Philippines, Philippine General Hospital, and I'm the current deputy chair of the Fragility Fracture Network Global Regionalization Committee. In the next 20 minutes, I'll be talking about the treatment of osteoporotic fractures in the elderly, the concept of orthogeriatrics, and breaking the concept of ageism in the country, and especially what's the important role of family physicians regarding the treatment of these fragility fractures of the elderly. I have no conflicts of interest for this specific presentation. So in the next 20 minutes, I'll be talking about the problem of fragility of fractures, not only in the Philippines, but also in the region. How do we stop the osteoporotic fracture cycle in the elderly? And what's the role of the family physician in this uh, fracture cycle? Also, I'll be discussing the challenges and the potential barriers of implementing the multidisciplinary care of fragility fractures in the Philippines and in the region, and what are the potential projects that we have, no, the Fragility Fracture Network, in promoting the concept of orthogeriatrics in our country. So, what's the importance of improving the way we treat elderly patients with hip fractures or the other fragility fractures? This is because when an elderly patient suffers a hip fracture, as high as 20 to 30% of them will die within 1 year of attaining the injury. 30% of them will have permanent disability. 40% will be unable to walk independently if they survive the hip fracture. And 80% will be unable to carry out at least one independent activity of daily living. So just imagine the impact, no, of this fracture to the productivity of the elderly and the burden that it will give to the family and to the community as well. The projected increase in the number of fragility fractures was first mentioned in the early 1990s, as shown in this slide. We may not notice it, but almost 30 years have passed since the first mention of this projection, and we are now in the halfway period. Although many developed countries in the West have already slowed down the steep increase of hip fracture occurrence, unfortunately, the same cannot be said for many countries in the Asian region. In the 2018 report of the ASEAN Federation of Osteoporosis Societies, the number of hip fractures in Asia is projected to increase from 1.1 million in 2018 to 2.5 million in 2050, a 2.28-fold increase. Also, the direct cost of hip fracture will increase from 9.5 billion US dollars in 2018 to 15 billion in 2050, which is a 1.59-fold increase. And for the low to middle income countries with very little financial reserves, this will have a huge impact the already stretched out economy of these countries. And this includes my country, the Philippines. This slide shows the old age dependency ratio of all the regions of the world. And as you can see, all regions have an upward trend. Simply speaking, the old age dependency ratio is the ratio of the working group of the population, those between 15 to 64 years old, to those who are dependent to them, mostly the young and the kids, as well as the senior citizen. And it is projected, even in low to middle income countries, that this will increase in the coming years. I will also mention the results of the secondary study from the International Orthopedic Multi-Center Study in Fracture Care, or otherwise known as the ENORMOUS project. ENORMOUS is a multi-center observational study that aims to evaluate and assess the global trends in fracture burden and how they relate to demographics. And it mostly involves low to middle income countries. In the secondary study, which was released in September 2019, all injured female patients enrolled were analyzed, which included the most populous countries in our region. According to this study, the most significant source of fracture was in the elderly and included common fragility fractures. Hip fractures were the most common fracture, Falls from standing height were the most prevalent mechanism of injury, and the majority of the fractures occurred in patients aged 50 and older. Given the relatively younger population in the ASEAN region, some experts may question the projections regarding the fragility hip fractures made in the early 1990s. However, the results of the secondary study of the enormous project supports the fact that this problem is not a hype, but in fact a reality that we should really address now before it becomes too late. As we enter the decade of healthy aging, the question is how can we contribute in solving the problem of fragility hip fractures in the elderly? How can we respond to the global call to action and convert this into actual actions? Focusing on the low to middle income countries in our region who now faced an enormous challenge with their respective healthcare systems, which was further compounded by the COVID-19 pandemic. The knowledge gap among healthcare professionals and caregivers about orthogeriatrics, the issue of ageism, the heterogeneous healthcare systems, the non-comprehensive healthcare support, and lack of prioritization from the government about fragility fractures are some of the challenges that most low to middle income countries are now facing. Case in point for the Philippines, my country. According to the 2013 Asia Pacific Regional Audit by the International Osteoporosis Foundation, it showed that only 25 to 50% of hip fracture patients are being surgically treated. And knowing the impact of hip fractures to the quality of life of the elderly, we cannot just simply accept this trend to continue. In many low to middle income countries in our region, there is still a huge gap in terms of fragility hip fracture management and quality data gathering. Again, in this 2019 published report, many countries still lack the necessary quality data to justify changes in healthcare policy regarding osteoporotic fracture management. There is a glaring need to address this concern in order to improve the management of fragility hip fractures in our region. Fortunately, through the efforts of the Fragility Fracture Network, we all now have these free learning materials like the orthogeriatric book as well as the clinical toolkit and policy toolkits that will help us or support us in participating in the fragility fracture global call to action, which is to provide multidisciplinary and ideal care for the elderly patients with hip fractures. By utilizing all of these learning materials and toolkits, we can now get all the necessary information to possibly start multidisciplinary orthogeriatric services in developing countries. However, the reality is this is easier said than done. Learning all the information and cascading it to our colleagues is an important step. However, this is not enough. We should be willing to really reach the grassroots level and understand the situation on the ground. We should identify the available services and resources of each country. More importantly, we should follow and map the existing pathway of care of fragility fracture patients in each country, as well as compare existing pathways with the globally accepted standards. And possibly, developing countries should formulate their own quality standards to improve the healthcare management of fragility fractures, using globally accepted standards as the benchmark, but also considering the unique situation of each country. So, why do we need to support the global call to action of the Fragility Fracture Network? This is because when we treat elderly patients with hip fractures, in the past we just focus on the fracture itself. However, in order to achieve successful management for these patients, we have to treat not only the fragile bone caused by osteoporosis, but it is also necessary to treat the frailty of the individual. And for us to render effective management, we need the help of the other co-managing services, including family physicians. And for us to promote the concept of orthogeriatrics or the multidisciplinary care of elderly patients with hip fractures, we need to break the concept of ageism in our country. This is termed as a radical alternative to the traditional model of care, wherein sometimes we don't give the elderly the necessary treatment that they deserve compared to the younger counterparts, simply because we regard them as already old and they have less to give in the community. But they can still be very productive, especially in our country wherein elderly still helps in giving care to their apos, to their daughters and sons, and they are still very productive and can still work. Maybe it's high time that we treat our elderly like they do in other countries, such as Japan and other parts of the ASEAN region. Well, in our country, bone health, no, as regards to healthy aging, should really start from the family, because in the Philippines, when an elderly patient suffers a hip fracture, it's actually the family support or the family which decides whether this patient would undergo surgical management or not. And it's high time that we really do our part, no, in introducing to the family members that when a patient suffers a hip fracture, it's really not dangerous for these patients, for these elderly patients, to undergo surgery, because together with the multidisciplinary care and multidisciplinary approach, they can still be very productive or they can return to their pre-injury status. The global call to action supported by the Fragility Fracture Network actually anchors on stopping the osteoporotic fracture cycle. And the family physician has a big role in stopping this osteoporotic fracture cycle in our country. Simply because when an elderly patient suffers a fragility fracture, there's a 20 to 30% chance that she will have another fracture in the next 2 years if the other pillars of the global call to action are not addressed, which includes not only the acute excellent surgery, but also excellent rehabilitation, as well as secondary fracture prevention and falls prevention. And as you can see, primary prevention of osteoporosis, although not yet given big importance in our country, should be promoted in the family level and in the community. And I think the role of the family physician, especially in the provinces and in the barrios, will really help in the primary prevention of osteoporosis as well in the secondary fracture prevention. Family physicians actually have a big role or a potential to promote the proven pathway of care in preventing fractures or secondary fractures, which is the FLS or the Fracture Liaison Service Program. In the community, there should be promotion of the 5 I's, which is to identify, investigate, initiate treatment for osteoporosis, and improve adherence, and also to improve the knowledge of the community in terms of the impact of osteoporosis to the health of the elderly. Fracture liaison services, or commonly known as FLS, are coordinator-based secondary fracture prevention services implemented by healthcare systems for the treatment of osteoporotic patients. In other countries, the nurses are the identified fracture liaison officers. However, I think family physicians and family doctors can also play an important part in promoting the fracture liaison service in order to close the care gap for patients or hip fracture patients in whom 80% are currently never offered screening and treatment for osteoporosis, and also enhance the communication between healthcare providers by providing a care pathway for the treatment of fragility fracture patients, and promoting this to the family members of the elderly patient who suffered a hip fracture. Again, the treatment of an elderly patient with a hip fracture should not stop after the surgery has been done, but rather it should be continued in the community long after the patient has been discharged in the hospital. By implementing the fracture liaison service program, the family care physician can help in continuing the care, especially in the community. And this should focus on immediate weight bearing and falls prevention of the individual, and the continued evaluation and management of osteoporosis, as well as the nutritional support and nutritional care of these patients who suffered fragility hip fractures. Furthermore, to help translate the strategies and the four pillars of the global call to action into actual action, the national FFNs can serve as a catalyst of multidisciplinary coordination among the existing associations, but with no intention of supplanting the existing organizations and societies in their respective countries. The creation of the national FFNs is the heart of the regionalization strategy. To further empower the national FFNs in bringing tangible changes in the healthcare delivery system of patients with fragility hip fractures in developing countries, the Fracture Pathway Mapping Tool project was conceived following the discussions at the Global FFN Congress at Oxford last year. Spearheaded by Professor Matt Costa, the past president of the FFN and co-chair of the Hip Fracture Audit Special Interest Group, the FIRMAT project aims to produce a web-based tool that can map, collect, review, and audit integrated care pathways for patients with hip fractures focused on low to middle income countries with no existing hip registries. The FIRMAT project aims to consolidate the partnership of FFN Global and the national FFN leadership in low to middle income countries. It also aims to address the missing data as the first step to improve care for patients with fragility fractures, describe and map in detail the service availability, general service readiness, and hip fracture specific readiness of low to middle income countries, and ultimately reduce mortality and improve health related quality of life for patients with hip fractures. The World Health Organization Service Availability and Readiness Assessment, or otherwise known as the SARA tool, will be used as the framework for this study. SARA was designed to assess and monitor the service availability and readiness of the healthcare sector and to generate evidence to support the planning and managing of healthcare systems. The SARA methodology uses systemic data collection to generate tracer indicators of service availability and readiness. This study will be supported by the extensive experience of the UK National Hip Fracture Database and the World Hip Trauma Evaluation that provides us with a clear understanding of the tracer indicators, which led to demonstrable improvements in care for patients with hip fractures in a developed healthcare economy. But these data, however, are poorly defined or absent in most low to middle income countries. The Global Fragility Fracture Network Minimum Common Dataset for Hip Fracture provides tracer indicators of optimal care based on the existing evidence. In high-income countries, it has been demonstrated that these indicators can be used to generate performance indicators or quality standards for patients with hip fracture that reduces mortality and improve quality of life. However, care pathways and hence appropriate indicators may be very different in low to middle income countries. In this project, we will map existing hip fracture management pathways in the Philippines, Thailand, and Malaysia to determine the general and service-specific readiness in each country in terms of key staff, existing hip fracture guidelines, diagnostic capacity and availability of hip-specific implants and medicines. At the end of this study, we will be able to identify potential key performance indicators for assessment in a larger study. This will be carried out by conducting surveys regarding hip fracture pathways in the above-mentioned countries. With the FIRMAT project, there will be an opportunity to map out specific pathways of care, which is bespoke to the low to middle income countries, and potentially identify which quality standards and key performance indicators are important and realistically attainable given the challenges and resources available in these countries. This infographic slide summarizes the overview of what the FIRMAT project envisions to achieve, which is not only to collect patient-level data and map out quality standards for fragility fracture management, but more importantly, to help the participating low to middle income countries develop their own toolkits that will facilitate ongoing service evaluation, so that hopefully in the end, also leave legacy infrastructure and tools that will continue national service evaluation, as well as train research fellows who can support and maintain sustainability of the national evaluation service tools developed even after the project has been completed.
In summary, the threat of fragility fractures is a real epidemiologic concern, not only in the Philippines but in the entire Asia Pacific region. There are still huge gaps to be filled about orthogeriatrics and the fracture liaison service, and we in the Fragility Fracture Network Philippines believe that the role of the family physicians is really vital in promoting the concept of the multidisciplinary and ideal care of the elderly with hip fractures, simply because the support and the belief of the family for this program to be successful is really needed. And you, the family doctors, are the ones closest to the heart of the Filipino families. Also, the national FFN, including the Fragility Fracture Network Philippines, can be a driving force and help us fill in these gaps. Going grassroots and identifying the situation on the ground is very important. And again, the role of family care doctors is very important to promote this in the community level. The projects of the Fragility Fracture Network Global, such as the FERMAT project, are important steps to attain global quality standards and bringing it to our country. And lastly, with all that I've mentioned in this talk, I would like to invite the Philippine Academy of Family Physicians to join the global call to action of the Fragility Fracture Network, and also as individuals for your fellows to join the Fragility Fracture Network Philippines. There we have a website which will be launched this month, and hopefully we can join you in this advocacy in promoting bone health in the elderly in terms of giving ideal care for elderly patients with fragility fractures. Thank you.